What does the coronavirus do to our body? You should know. The most common symptoms of coronavirus are fever, dry cough, tiredness, and shortness of breath, can signal any number of illnesses, from flu to strep to the common cold. The COVID-19 virus is thought to spread mainly from person to person. Between people, who are in close contact with one another within about 6 feet. Through droplets transmitted into the air from coughing or sneezing, which people nearby can take in through their nose, mouth or eyes. From infection, it takes approximately 5 to 12 days for symptoms to appear. Here's a step-by-step look at what happens inside the body when it takes hold. Here is what medical experts and researchers have learned so far about the progression of the infection caused by this new coronavirus. Once inside the body, it begins infecting epithelial cells in the lining of the lung. A protein on the receptors of the virus can attach to a host cell's receptors and penetrate the cell. Inside the host cell, the virus begins to replicate until it kills the cell. This first takes place in the upper respiratory tract, which includes the nose, mouth, larynx and bronchi. The patient begins to experience a mild version of symptoms: dry cough, shortness of breath, fever and headache and muscle pain and tiredness, comparable to the flu. The WHO reported last month about 80% of patients have a mild to moderate disease from infection. A case of mild COVID-19 includes a fever and cough more severe than the seasonal flu but does not require hospitalization. Those milder cases are because the body's immune response is able to contain the virus in the upper respiratory tract, Hirsch says. Younger patients have a more vigorous immune response compared to older patients. The 13.8% of severe cases and 6.1% critical cases are due to the virus trekking down the windpipe and entering the lower respiratory tract, where it seems to prefer growing. The lungs are the major target, Hirsch said. As the virus continues to replicate and journeys further down the windpipe and into the lung, it can cause more respiratory problems like bronchitis and pneumonia, according to Dr. Raphael Vicidi, infectious disease specialist at Johns Hopkins Medicine. Pneumonia is characterized by shortness of breath combined with a cough and affects tiny air sacs in the lungs, called alveoli, Vicidi said. The alveoli are where oxygen and carbon dioxide are exchanged. When pneumonia occurs, the thin layer of alveolar cells is damaged by the virus. The body reacts by sending immune cells to the lung to fight it off. And that results in the linings becoming thicker than normal, he said. As they thicken more and more, they essentially choke off the little air pocket, which is what you need to get the oxygen to your blood. So it's basically a war between the host response and the virus. Hirsch said. Depending who wins this war, we have either good outcomes where patients recover or bad outcomes where they don't. Restricting oxygen to the bloodstream deprives other major organs of oxygen, including the liver, kidney and brain. In a small number of severe cases that can develop into acute respiratory distress syndrome (ARDS), which requires a patient to be placed on a ventilator to supply oxygen. However, if too much of the lung is damaged and not enough oxygen is supplied to the rest of the body, respiratory failure could lead to organ failure and death. Vicidi stresses that the outcome is uncommon for the majority of patients infected with coronavirus. Those most at risk to severe developments are older than 70 and have weak immune responses. Others at risk include people with pulmonary abnormalities, chronic disease or compromised immune systems, such as cancer patients who have gone through chemotherapy treatment. VICID urges the public to think of the coronavirus like the flu because it goes through the same process within the body. Many people contract the flu and recover with no complications. People should remember that they're as healthy as they feel, he said. And shouldn't go around feeling as unhealthy as they fear.